Welcome to
Good
the
evening.
talk show, Legends of Neurology. Today, the legend of neurology guest is Professor C.U. Velmurugendran, sir, from Chennai. Good evening, sir.
Good evening, ma.
Good evening, sir. It is indeed a great privilege and honor to interview my mentor, Professor C.U. Velmurugendran. Hailing from a family of highly decorated Siddha physicians from a small town of Kanigapur, close to Madras, Professor C.U. Velmurugendran has been teaching young neuroscientists since 1969. He's truly a doyen of neurology, having mentored nearly 200 professors of neurology, psychiatry, neurosurgery, and general medicine. Let us delve into the spectacular life of Professor CUV, or Chief as he is fondly called. Ladies and gentlemen, presenting to you Padma Shri, Sri Professor Kanigapur Uttamaroyan Velmurugendran and his journey in neurosciences. Welcome once again, sir.
Oh, thanks for your kind words, Dr. Chandana.
Please, sir. How are you doing today, this evening, sir?
Oh, fine.
Fine, sir. So let us start off the talk show, sir. So you're from Kanigapur, which is a small village near Chennai. So where did you spend your childhood, sir? In Chennai or in Kanigapur?
All the time I was in Chennai and in a place called Triplicane. It's one of the old villages which has become a town now. And those days, the schooling can be done till the 6th standard and then they can join the school. So I was taking tuition till my 4th standard. When I joined the school, I did my schooling in Chennai. And when I passed my SSLC, or the 11th standard, those days, I was only 12 and a half years old. So I was ineligible. Yeah, I was ineligible to join college. So I had to wait for a year going to some other college off record. And then ultimately I joined the famous Loyola College, where I studied. I got the first rank in my district and then proceeded on to my MBBS course.
Wow. So truly a prodigy at a young age of 12 and a half years, sir, having passed your 10th standard. That's truly great, sir. So you hail from a family of doctors. Can you please share the details of your family with us, sir?
My grandfather was the first one to start the Siddha teaching, the School of Indian Medicine in Kilpak, which has now become the Kilpak Medical College. And his name is Dr. C. Murugesa Mudaliar, and he was awarded Vaidya Ratna by the Viceroy of India in early 30s. My father, Dr. C.S. Uttamarayan, you see the photograph here, was the first director of Indian medicine, and he is also a Vaidya Ratna awardee.
So what sparked your interest in neurosciences, sir? So tell us about your journey as a medical student and training in neurology in Madras Medical College.
When I was doing my MD medicine, I thought I will do tropical medicine and continue to specialize in that. Then I was seeing leprosy patients in the leprosy ward. I've seen more than 1,000 of them, and the leprosy was rampant at that time in our country. And there was so much of stigma attached to that. So I wanted to treat them, counsel them, and give them encouragement. At that time, only the TM Neurology course was started at the Madras Medical College. My mentor, Professor Ratnavel Subramaniam, said it will be a great idea to join TM Neurology because it's a newer specialty. And I always obeyed him and joined DM Neurology course. I was only 27 years then. So I thought it is right to join a course and then study, then to work.
So you worked under Professor Ramamurthy and Arjunda sir and Professor Kanaka. We're all on the screen.
When I joined, Professor Ramamurthy was the head of the department. As you know, he's the father of neurosciences as a country. He is the one who started neuroscience in India in 1950s. And we also had eminent professors like Professor G. Arjundas and Professor Jagannathan. It was a combined unit, neurology and neurosurgery. So I had exposure to many neurosurgeons. Professor, eminent neurosurgeons like Professor V. Balasubramaniam, Professor Kalyan Raman, and Professor Kanaka. So we had a combined classes, and when I am doing duty on my duty days, I have to look after not only the neurological emergencies, but also neurosurgical emergencies. So that enabled me to go to the theater several times, assist the neurosurgeons, and helped me to learn. This had helped me to learn a lot of neurosurgical principles, what they do in the theater with the brain.
Oh, that's great, sir. That's indeed great. So after completing your DM Neurology, you were trained at National Hospital at Queen Square, London, sir. So any anecdotes that you fondly remember from your days over there?
No, those days, if you take any book, the main authors will be only from Queen Square. And many visitors from UK and other countries, mainly they are from Queen Square, London. So it was my great ambition in my life to work in the Queen Square. So I got a WHO fellowship and I opted to work at the Queen Square, London.
Oh, did you ever consider staying back in UK, sir, after having worked there?
No, you wanted me to tell about the anecdotes in.
Yes, sir, anecdotes. And did you ever consider staying back in UK at that time?
Yeah. When I went there, I was posted to Professor Roger Gilliard's unit. He was the head of the professorial board of the University of London. He appointed me as the honorary senior clinical assistant in the London University. So I worked with him. He was known for his work in peripheral neuropathies. And we had very good professors like John Marshall and Dr. Ross Russell, who were specialists in cerebrovascular diseases. At the time, Dr. Dennis Williams, the legendary physician, was working there. And we had McCardle, we had Christopher Earle, were all excellent clinicians. And the evening hours, I went to Marian Smith, who was an anatomist. She taught me neuroanatomy bit by bit. On Thursdays, I used to go to the balance and hearing and balance unit run by Hallpike and Dix, where I learned how to examine a patient with vertigo. And I also had the association of Dr. Elizabeth Warrington, who was a cognitive specialist of Queen Square, which has helped me later in life to learn cognitive neurology. After the clinical hours, I was posted to the EEG department. Dr. William Cobb was a very senior EEG specialist, was very well known all over the world. He used to give me 20 EEGs per day to read. And so after that, he used to sit down and correct and tell me what is wrong and what is right and taught me EEG. Dr. Willison and Dr. Win Perry were in charge of electrophysiology. They taught me nerve conduction studies. This is how it went on. At the time, the neuroradiology was handled by the most famous James Bull and Dr. DeBolle.
Oh, okay, sir.
And then the first set of CT scan arrived only in the Queen Square, London. And it was handled by a registrar on the neurology side. So I saw a lot of CT scans and learned quite a bit about the CT scan, because at the time it was not available in India.
Yes, sir. So you have worked there with all the famous personalities, sir. Have you ever considered staying back there?
No, I never wanted to stay back because after I wanted to have a good training in London and come back and serve my own country. So
that is India's gain and London's loss, if I may say so, sir. That's wonderful indeed, sir. Sir, cognitive neurology is one of your passionate interests. So how did you focus on this fascinating yet relatively unexplored subject at that time?
As you rightly said, cognitive neurology was very much unexplored at that time, excepting Dr. Vimala Vermani from the All India Institute of Medical Sciences who was doing that. No, when I was working in the ward, I saw a patient who who was wearing a socks over his left shoe.
Mm. Mm.
I asked him, why are you doing that? You've already got a shoe and a socks.
Mm.
He said, I'm feeling very cold. So when I insisted on the history, he told me that he feel that there is an extra foot on the left side.
Mm.
Then the only available test at that time was direct puncture carotid angiogram, and it showed a large meningioma on the right parietal region.
Mm.
After surgical removal, the foot has disappeared.
Oh, that's wonderful.
Then I went through McDonald-Crichlis monogram on parietal lobe. It was not a book, it's not a medical book, it's more like a novel. There are so many anecdotes that have been quoted by him in that book. So I carefully saw my patients and found many of them neglecting one half of the body, shaving one half of the face, dressing on one side of the body, wearing only one chappal. And so I took interest in other areas in the cognitive neurology. Actually, I prepared a pro forma, which I used to fill, and later on it was used for several years at the Institute of Neurology.
Oh. You had worked with other professors like Professor Rajashekar Nair and Professor Satyanarayana too, sir. So with your work on cognitive neurology was with them, sir, I believe. Please tell us about your experiences with them, sir. Professor Rajashekar Nair. And
Professor Rajashekar Nair studied in All India Institute of Medical Science. He was posted to the Madras Medical College for 3 months, where I had the contact with him. Professor Satyanarayana from Visakhapatnam, Andhra Pradesh, studied his DM neurology at MMC a few years after me. And 3 of us used to get together, talk about cognitive neurology, conduct CME programs. And whenever we went as an examiner, we asked to ask questions to the students on cognitive neurology. So most of the students thought they should know cognitive neurology to pass their exam. And then slowly the momentum gathered.
That's wonderful, sir. So then you started your teaching career at Stanley Medical College in 1975. And I believe you were the youngest professor of neurology there, sir.
No, I got promoted at the Madras Medical College itself in 1972 when I was 32 and a half years old.
Oh, very, very young age, sir.
A very young age. At that time, I was there for an year and then left for UK to be trained in Queen Square. On my return in 75, later part of the 75, I was posted to Stanley Medical College. And then at that time, there was no other professor other than me in neurology. The other professors of medicine were more interested in teaching cardiology, tropical medicine, and so on. So the students gathered around me, both undergraduates and postgraduates, and I was able to teach them neurology.
We have yes, sir.
Yeah. Then I started the DM neurology course there, and a licentiate course in electrophysiology, a first of the kind in our region. Luckily, my first DM student was an extraordinarily brilliant man called Dr. K.S. Salam. He is now a very popular neurologist at Kozhikode, Thiruvananthapuram.
We have Dr. Salam with us, sir. He's here to share his experiences with you. So playing Dr. Salam with you.
I joined Stanley Medical College, Chennai in 1980. I was the first DM neurology student of Professor C.O.P. And very soon, I was like family to him. His passion to teach neurology and medicine is unbelievable, but he is also highly ethical and professional and extremely humane when he deals with patients and his subordinates. I must say that he was instrumental in shaping up my future and my career. I learned a lot of values from him, good values in life, compassion, gentleness while dealing with patients. And I also learned how to lead without fear and prejudice. I can say that humanity was his race and love his religion. So in 2014, when Dr. Javed, my son-in-law, wanted to join for DM Neurology, I had no second thoughts. Professor CUV was at that time heading the Department of Neurology at SRM Chennai. So I told Dr. Javed to try to get admitted there, to try to get a seat at SRMC. And with Professor CUV's blessings, he got admitted there, and Dr. Javed still cherishes the years he spent there with Professor CUV. I wish him well, and I hope he will have many more years of constructive and contented life ahead.
Thank you, Dr. Salam. Sir, then tell us about the interesting work on reflex epilepsies and other significant changes at Stanley Medical College, sir.
The Stanley Medical College, they used to get a lot of patients with epilepsy. And in 1980, I had a patient, a lady, who threw a fit every time she heard the drone of the aeroplane. Then I was scanning through the literature and found that Dr. MacDonald Critchley, the famous neurologist of Queen Square, has described the auditory form of epilepsy. Then I had all varieties of epilepsy. The reflex epilepsy is known in Siddhara literature in Tamil 1500 years ago, about men who took bath and behaved abnormally and threw fit. But then they are not given any explanation for that. Professor K.S. Mani, an important neurologist of our country from Bangalore, he worked very keenly on this group of patients and described them in detail. And then the work continued further in months. And I had all varieties of reflex epilepsies, the auditory, visual, gustatory, olfactory, and tactile, and startle. Unfortunately, I could not record them because we did not have a video
those days
monitoring in those days.
Yes, sir. True. So then I have here Professor Bhupathy, sir, who is here to share his experiences working with you at Stanley Medical College, sir.
Friends, Atmasti, C.U. Velmurugendran is known to every one of us. He's a great teacher, eminent neuroscientist, and good human being. I, as a student, PG student, DM Neurology training, and this colleague have been working with him for the past almost 30 years. He is one who established the Department of Neurology at Government Stanley Hospital. Later, he was the director of the Institute of Neurology at Institute of Neurology, Government Dental Hospital. Thereafter, he established the Department of the Institute of Neurology at Sri Ramachandra Hospital, and he is the one who created most of the neurologists. He was the director of the Institute of Neurology at Institute of Neurology, Government Dental Hospital. Thereafter, he established the Department of the Institute of Neurology at Sri Ramachandra Hospital, and he is the one who created most of the neurologists in this state as well as the country. As a human being, he has an excellent qualities of being a teacher, being a head of the department, and he is an excellent guide to each and every one of the topmost neurologists today. Well, intimate, attachment with the Professor CU as well as his family, who helped me. Not only helped me, so many other neurologists, and their help is commendable. I wish him a long life. Thank you very much.
Thank you, Professor Bhupathy. So that was after Stanley Medical College. I believe you went back to Madras Medical College again, sir. Institute of Neurology. Yeah, please tell us.
All the time I was eyeing to go back to the Madras Medical College.
Your alma mater. Yes, sir.
Yeah, my alma mater, where I've been trained for my first year MBBS. I went back to the Madras Medical College in 1985. I was a professor of neurology for 4 years. At the end of 4 years, I became the head of the Institute of Neurology. The Institute of Neurology is a small hospital by itself, where we had neurology, neurosurgery, neuropathology, neurochemistry, psychology, speech therapy, physiotherapy, and all other, and sociology, and all other subjects together.
Yes, sir.
So the doctor group itself amounted to about 40.
Oh.
So we have to manage the administration at that time in addition to my clinical work. This is the period at which I presented my 176 cases of reflex epilepsy in the World Congress of Neurology at Hamburg, Germany. So I was training my students in MMC very meticulously and running the outpatient clinic, which is a very large one, and also doing research. Two of the multicentric researches I have done there. One is on gabapentin. So gabapentin at the time was used as an add-on therapy to the epilepsy, anti-epileptic drugs.
Okay, sir.
Now, of course, we don't use it so much in epilepsy. Yeah. Then in 1989, we had the World Congress of Neurology at New Delhi.
Sir. So it was here when you were started about the creating awareness about epilepsy and also starting the International Epilepsy Day, I believe, sir. Well, you were
can I finish this?
Yes, sir.
Can I finish this? We had this World Congress of Neurology.
Yes, sir. That's what I meant.
In 1989.
Yes, sir.
The entire staff, the professors, assistant professors, the speech pathologist, neuropathologist, chemist, everybody, 26 of us went and attended the 13th World Congress of Neurology at New Delhi and presented our papers. My paper was a neurology of pregnancy and puerperium.
And then, sir, please continue.
Yeah, please go.
I was asking you about this International Epilepsy Day and they're creating about the awareness about epilepsy, sir. So that was very crucial point.
In 1970,
yes, sir.
We had the inauguration of the newly built Institute of Neurology. That marked the 20th year of the Neurological Society of India annual meet.
Okay, sir.
Professor E.P. Barocha, a senior and a very famous neurologist from Mumbai, he addressed us and said that we should start the Indian Epilepsy Association and spread the awareness to the public, which will be very useful. In 1 year later, 1971 itself, I started the Indian Epilepsy Association as a secretary, along with Professor K. Jagannathan and Professor G. Arjun Das. And then we used to have public awareness program. In 1985, it gathered momentum. We had large meetings. where celebrities like the film stars, ministers, bureaucrats used to come and they used to gather in a large number. And these were published in daily newspapers, both Tamil and English.
Okay.
And they were covered by the newspapers at the time and also by the television and radio. It went on like that. At that time, I started the sheltered workshop for epileptic patients. We are very poor chronic epileptic patients, very young boys. I hired a school, a corporation school, and then put them there, about 30 or 40 of them. Used to give them anti-epileptic drugs daily, and the midday meal was supplied to them. Bus pass was given to them.
Yes.
So they were trained in 3 or 4 trades like chalk making, candle making, book binding, and tailoring. At the 1 year of training, they had a reasonable control of seizures for at least 1 year. So they were given the appropriate equipments. They went back and then led a normal life with their own equipments and the trade.
So
now it is being
now
it is being carried on at the Institute of Neurology.
It's a process of rehabilitating them into the society, I believe, sir. So
Society.
that is how it is. Society.
At the time, there is a big stigma about epilepsy.
Yes, sir. True.
People never thought it is a disease. They thought they were possessed by evils and so on. They were giving treatment to the magicians and so on. So these things help them to lead a normal life, and public was also aware that this is a disease which can be controlled and can they lead a normal life.
It's an indeed and wonderful effort, sir. So then we have Professor Banu here to talk about those days of working with you, about the International Epilepsy Association and the other work that she had undertaken with you, sir.
It's indeed an honor to speak about my professor, Professor C. Velmurugendran. He is a very God-fearing person who taught us not just neurology, but also other ethics in life. He made us imbibe our organizational skills as well as administrative skills, which had stood by me for the greater part of my administration. And any issues we had, we could always turn to him and he would always sort it out for us. We had organized multiple conferences, national, international ones, as well as multiple workshops. I distinctly remember the neurophysiology workshops which we did. And with Dr. Omar Marken, C.D. Binney, Dr. Zaiwala, and Dr. Bhagwan Shahani. It's all hands-on workshop with cameras in different places, different rooms projecting onto the center. And this was all in the 80s and the early 90s. And, it's not like today where everyone has a cell phone. It's so easy to, it was a great task. And he made sure that it went on very well. So it made us realize if you're persistent, you can always get things done. That was one thing which I really learned from him. You have to be persistent enough if you want to get something done. And we have been doing the epilepsy days. It was during this period that we started the National Epilepsy Day. And every year we used to do National Epilepsy Awareness Program. This used to be in different parts of Chennai. Sometimes it will be the museum theatre, sometimes it will be in an auditorium, sometimes it will be in our hospital. And we used to have a lot of patients and participation with questions from them where we used to clarify the doubts. Subsequently also, he has been helping us when we won the award for we won an award from the International Bureau Against Epilepsy for starting a baking class, and we have started it, and he has been instrumental in it as the IEA president, and it's still continuing on with about 250 members being benefited from it, and also being giving awards. Thank Professor CV for all this, because this has helped us, his students, to achieve greater things in life wherever they are. Thank you, sir. And thank you, Madam CUE, who's been like a mother to me throughout my career. Thank you, Madam, also.
So that is Professor Banu, sir, talking about your days together and the establishment of the epilepsy activities, sir. So, sir, after you had retired from the government service, you joined Sri Ramchandra University and served the university for 17 years. Can you tell us about some important milestones, achievements there, and some memorable moments too, sir, at Ramchandra University?
After my retirement, I was invited by the Dean of the Sri Ramchandra University, Dr. S. Thanikachalam, to be the professor of neurology and head of the department. And we started the department of neurology there. And the chancellor, Mr. V. Venkatachalam, was kind enough to help us in all ways to develop the department. So immediately after joining, I could start the DM neurology course, where I could have 2 DM neurology students every year. We had a devoted stroke center, which catered to acute stroke and also rehabilitation care, which was run at a very low cost. And so it attracted many people throughout the country, and we could help many of the patients with stroke.
So you had, sir, please go ahead, sir.
And I continued the work of organizing CMEs, etc., because we had organized several CME and national international conferences, MMC. To mention a few, we had the Association of Physicians of the Association of Cognitive Neurology. We held a large meeting, and we had faculties from UK, USA, Australia, etc. And the people who attended were not only neurologists, but also the psychiatrists, psychologists. I even invited students who are doing their BA course in psychology, so that they will get a good exposure to cognitive neurology.
Oh, that's nice, sir.
That I continued. And in 1993, we held the Neurology Society of India's meeting at Chennai. They very well appreciated and attended in a very calm, beautiful place. And then at the same time, within a few days, I have conducted the first Indian Epilepsy Association annual meet. And that was going on. And then 1997, I conducted the annual meeting of the Indian Academy of Neurology. So between this period, I have become the first elected secretary of the Indian Academy of Neurology. And 4 years later, I became the president of the Indian Academy of Neurology.
It's wonderful, sir.
And the same legacy I continued in Stanley Hospital, where I conducted several orations and teaching program. So I was very much helped by my colleagues, Dr. D. Vasudevan, Dr. U. Meenakshi Sundaram, and Dr. V. Shankar. Dr. U. Meenakshi Sundaram was very excellent in doing things, in organizing capacities, and whatever I had in my vision, he could carry out. Even today, organizing many national and international congresses. In 1917, we had the Indian Academy of Neurology Silver Jubilee, which was organized by him, which was attended by more than 2,000 people.
Oh, that's wonderful.
Now he is the secretary of the Indian Academy of Neurology.
Yes, sir. Yes, sir.
So I wanted my students to not only learn, teach, but also get the organizational capacity to organize big conferences and also participate in the important bodies like Indian Academy and MDSI, etc.
Wonderful, sir. So it was also here at Ramchandra that you did some excellent work about alpha feedback, sir, and the electrophysiological studies too.
I was given grants by the DRDO
sir.
to conduct the alpha feedback.
Okay, sir.
This work was started by me at the Institute of Neurology itself, but then I left, went to Stanley, and the whole thing did not materialize.
Okay,
the principle here is to, as you know, that EEG is a mixture of many kinds of rhythms. We used to filter everything and take out only the alpha rhythm and then convert it into a visual or auditory stimulus, and then feed the patient. When we were feeding the patient, I mainly did only the auditory. Their alpha rhythm also has increased in number,
Okay.
and they become very. They said that they become very calm, and then that has helped them a lot to be better in life. So this we wanted to prepare machines and give it to our army men in circumstances of emergencies, where they can keep cool and carry on with their work. That's the idea of doing it.
Yes.
By the time ICMR also has helped me to do a few projects,
Sir.
and more than 10 multicentric drug trials are conducted. And one of that is on safenamide, which is now a valuable drug in the treatment of Parkinsonism.
That's wonderful. And also some electrophysiological studies where you were over there, sir, apart from the alpha feedback, the visual M potential, sir.
So along with the ophthalmologist and IIT,
okay, sir.
We did some work on conduction of the visual pathway through the retina.
Sir.
And the reaction in the retina, the potentials created in the retina, that was published subsequently by the IIT journal.
Sir. Okay. It's wonderful. So now we have Professor Meenakshi Sundaram, sir, ready to join us to share his thoughts about working with you, sir.
I have had the privilege of knowing Professor CUV for more than 25 years. It's my special privilege. And, it started as me being a student, and there is no better person as regards to clinical neurology. He gave me the joy of enjoying clinical neurology, and it is not uncommon to see him rushing to see a rare clinical sign or a syndrome or a disease. As soon as we discuss it, he is there in the ward. You would have seen it with a childlike enthusiasm. It is a great clinical acumen. And I learned a lot of things from him about how to administer. It's really helped me in my life. The sense of calm, the sense of the sharpness with which he takes decisions. Sometimes we say he takes decisions and then comes for discussion, and then it's always right. And it's always a nice thing to know that you can take decisions with consensus and need not always be in the face with anyone. And that's something that he has really taught me to do. He is been a wonderful academician and a researcher, has backed many projects, and he would, I still remember how he went about enthusiastically presenting to the DST for a grant when they came visiting Ramchandra. And as an organizer, if I'm a little bit good at organizing, I think I owe everything to sir. Because the CV taught me the nuances of organizing, managing people, getting the finances, making sure everything is right. And lastly, as a family man, I had a wonderful time with sir and his family. We have traveled together to many places, and it has always been a pleasure to share those lighter moments, those a little funnier moments, the very, very unforgettable moments that we have had during the travel. Thank you very much, sir, for all the education and for all the wise words of wisdom that you have imparted. I owe a lot. I owe almost everything in neurology to you. Thank you so much, sir.
So all your students have acquired their organization skills from you, sir. That's wonderful indeed. And moving on now, I have something to share with everyone, sir. Your awards and achievements. So just putting together a small slideshow, your awards and achievements, sir. So sir has been awarded the FRCP from Glasgow University in 2006, DSc Honoris Causa from Madras University in 2007. And he has received the Padma Shri Award in 2008 from the then President Pratibha Singh Patil. and he has received the Lifetime Achievement Award from Savita University in 2018. And lastly, but not the least, the IN Lifetime Achievement Award was presented to Sir in the year November 2021. So a picture is worth 1,000 words, sir. Now I would want to show you some pictures, and please tell us about when and how the pictures and what is the story behind these pictures, sir. The first picture, sir, with Professor President Kalam. Yes,
the first picture to the left,
sir.
is about His Excellency Abdul Kalam, our former President of India.
Yes, sir.
He came to Sri Ramchandra Hospital for inauguration of the college day. At that time, he said that we should impart our knowledge to far off places which are underdeveloped, like Africa, give them a medical consultation, and also teach the students there through video conferencing. So a video conferencing was set, and a separate theater was created for that by the Department of Telemedicine by Dr. K. Kumar. And one day when I was doing that job, he came and they wanted to show him. He was brought there. I was doing the teaching. Then I tried to get up out of respect, but he kept his hand over my shoulder and asked me to sit. And he was standing and watching. So it's a great soul, a great man.
Yes, sir.
Very humble.
Very humble. Yes, sir. Yes, sir.
What is to your right
Yes.
is very interesting. You see a small picture.
In picture, yes, sir.
Carried by Dr. Kalam. This is a picture taken at Madurai IAN, where he was the orator, IAN orator. I was the president. I'm standing and welcoming him. And that picture was enlarged, and he signed and presented to me when came at another time to Sri Ramchandra Hospital.
Okay, sir.
And he told me, see, I was a president. I was standing and you were sitting. Look at Madurai picture. You were the president. I was not, but you were standing and presenting it to me. So that is a statement that he made.
Right, yes, a very great man, humble man indeed, sir. So
Very, yes.
Yes, sir. And then tell us about this temple, sir, and your association with it.
The temple is very near my house. It is 300 years old. This is our family trust. I go there morning and evening if I am in Chennai, irrespective of whatever work I have, and then draw the inspiration. Because I thought I should get the strength from my Lord to teach my students and also to treat my patients successfully.
So now this is an interesting photograph of your family and your students on your 80th birthday, sir. So how do you feel on that day?
No, I was feeling very elated because my students have organized my 80th birthday. It was a day-long program. In the morning, I had the CME. In the evening, we had the social function. My chief, Professor Arjundas, is there. He stayed throughout the day with me. And then you see a lot of my students.
Yes.
Not only from the city, they are from outside the city, and 1 or 2 are from abroad. It's a grand success as far as they are concerned. And it's a great satisfaction for me. And to my left, I stand with my wife.
Yes, sir.
Who has been the pillar of my strength. And then she has been taking all the burden on her shoulders. She was taking care of the household, children, and myself. Without her, I would not have been successful. All say that for a successful man,
yes, sir. Yes, sir.
there should be a lady behind.
Yes, sir.
But she has never been behind. She was all pervasive.
She was all pervasive. Wonderful indeed, sir. Wonderful, sir. So, and now this is a picture of you on your vacation with your family, sir. And we see that you had a great time with birds. So tell us about your journeys and vacations, sir.
If you look at the left picture, it is a Taj Mahal.
Sir.
You can see the Taj Mahal there. To my right, we had a we had a holiday in Bali.
Okay, sir.
This is the Bali Zoo
Okay, sir. Okay.
where the birds are there.
But yes.
Yeah, because I indeed love traveling extensively, particularly to go abroad to places like Bali.
So that's
So
nice.
this is one of the enjoyable moments with my
Yes.
family.
Yes, it's wonderful. Sir. Then you had students and your guidance have awarded as all-rounders, sir, not only in neurology, but also in other aspects such as organization skills, conferences, and many of them have become good orators, teachers, and professors, sir. So you had your mentors with you. How did you feel that if your mentors were with you, how would they have appreciated this moment, sir, that you had successfully trained many professors? So you have trained many students and your guidance evolved as all-rounders, sir, not only in the field of neurology, but also in other aspects like organizational skills, good orators, teachers, and professors. How would you feel if your mentors were with you today, that you were so successful in creating so many professors and organizational leaders, sir, in this field of neurology?
No, they taught me the basic
Sir.
medical science.
Hmm.
They taught me three things. That you would start patient's care first, then teaching, and automatically research will evolve. Then we'll go on to the organization skills.
Yes.
I've been trained by Professor Rathanvel Subramaniam,
Yes, sir.
the professor of medicine, Professor B. Ramurthy, the very eminent neurosurgeon of the country, Professor Jagannathan, and Professor Arjun Das. An extra word about Professor Arjun Das.
Sir.
He was not only a great clinician and teacher, but he had great organizational skills and one of the very kind-hearted person. And he will all the time be trying to help people, whether you ask for it or not. So I've been trained by such people. I have always been in the company. Professor Arjun Das still continue to work with us.
Sir.
And it's memorable.
Wonderful indeed, sir. Wonderful. So now we want to get to know the man behind the legend, sir. So tell us about your family, sir. I hear the legacy of medicine is being carried on by your children and grandchildren, sir.
I told you earlier that my grandfather,
Sir.
C. Murugesan Mudalyar, was a Vaidyaratna awardee from the government of India, actually government of Britain. And my father also was the first director
Sir.
of Indian medicine. And he was also a Vaidyaratna awardee. And then I married Mrs. P. V. Pattavardhini. I told you that she is a pillar of my strength.
And yes.
And then I had three good children. The first one is Dr. Kritika. She is a PhD in neuropsychology. And then my second daughter is Jayashree. She is a master of law. And the third one is Dr. Shankar Ganesh. He is a neurosurgeon working now at Apollo Hospital as a senior consultant. And my daughter-in-law Tilakavati is a senior consultant in aesthetic medicine. And two of my grandchildren are now in medical college. I want my granddaughter to also be groomed to do medicine. We want to learn medicine and serve the community all the time. I wish that my generations continue to do the service to the human.
Yeah, that's wonderful, sir. And we have heard about another hidden aspect of your life is of philanthropic activities, sir. You had sponsored education of many children from schooling till post-graduation. So how did this idea originate, sir? This idea of philanthropic activities?
Because my grandparents and my parents were helping our relatives to learn in the schools and even in the colleges. They gave education to them. I wanted to continue that and educate many of the poor children who cannot afford. Some of them are now working in banks and big offices, etc.
Wonderful, sir.
And I became the president of the Hindu Senior High School, which is the 180 years old, where I could help many students. I established many awards for them to be encouraged. So they will get the prizes and awards. So they should be encouraged to become great people later in life.
Sir. That's wonderful, sir. And also, I want to know about your love for car rides, sir, that you had gone on long adventurous rides and your love for driving.
Yeah, I love driving. because as sooner I started driving, I picked up the speed. I always wanted to drive fast. You know, it's difficult to drive in Chennai fast.
That's
But
true.
still,
Traffic, yes, sir.
but still, many people have complained to my family that I am driving rash.
Rash.
When I went out, I drove my car, and then I drove my car in the forest in Nilgiris.
Oh,
Enjoyed
quite
driving.
adventurous, sir. Yes, sir.
Yeah.
Oh, and your love for cooking, sir. I heard that you used to make pickles at home.
That is a novice attempt making pickles at home with lemon and
Okay.
mangoes.
Okay, sir. Wonderful, sir. So, if you had gone back in time and would have done anything differently, was there anything else that you had wanted to become, or that you have done differently, sir?
Now you would have now understood that I have been a man was with
Yes.
golden spoon in my mouth.
Yes, sir. Yes, that's
I
true.
learned everything when I was very young.
Mm,
Became a professor when I was very young,
sir.
and I've been able to teach, able to train many of the students,
Sir.
and many of them have won awards at the national level.
Yes, sir.
Some of them got IAN award when I was in MMC, and one when I was in Sri Ramchandra. And you yourself is has won many awards.
Yeah.
I'm very happy
Sir,
that the interviewer also is an awardee.
thank you, sir.
So,
It's all under your great guidance and our great thanks to you, sir.
so I had everything that I wanted.
Perfect, sir.
Nothing to think of something new.
Perfect, sir. Perfect, sir. So what would be your message to the upcoming neuroscientists of the country?
Again, the three things they should have. First, patient's care. 2, teaching. 3, research. Patient's care should be a thorough clinical examination because that will give the diagnosis with the history taking. And then the investigations will come only next to that.
Yes, sir.
It will probably add value to your clinical examination.
Sir,
That will be my first advice. Then teach others also.
sir.
3, we can do research and publish papers and get a good name. And then organization, etc., comes while you are in teaching program.
Perfect. Perfect. Thank you so much, sir. And now we have a small surprise for you at the end, sir. What we have prepared is all your students over the years have come together, and we had put forward a small tribute and a standing ovation to you, sir.
Thank you, Dr. Chandana, for these lovely clippings of my students whom I love. And they have instituted an oration in my name and also a gold medal at the Madras Medical College. Very glad to see them alive and standing before me.
Yeah, thank you so much, sir. This is a gratitude from all of the students over your time, sir. The moment we have asked, many of them reached out immediately, sent us the videos and helped a lot, sir. For this presentation, I have to first thank IAN for giving me this opportunity, and also Mrs. Kritika, your first daughter, sir, who has helped me a lot, getting me all the photos and all the information together. And Dr. Anvesh Kotagiri from Vijayawada, sir, who has made this presentation, collecting the videos. And it's been a thank you so much, IAN, for giving me this opportunity to interview my mentor, Professor C.U. Velmurugendran, sir. Thank you, sir.
Oh, thank you, Dr. Chandana.